I wanted to start a little bit with an executive session, if that's possible, and really just to sort of review some of the legal matters that we have to contend with all of the various requirements. And I know we want to get done early, so I'm going to call or try to make sure that we're expeditious in how we deal with this. So what I'd like, members of the board, I'm going to recognize that we have the treasurer, the auditor, the secretary of state, and myself. I believe the superintendent is excused. That does give us a quorum. Madam Director, is there anything you'd like to begin the meeting with?
Mr. Chairman, thank you. Just to recognize that this is a special meeting of the State Loan and Investment Board to consider Health and Human Services ARPA applications. And with that, I'll turn it back to you for executive session or however the board wishes to proceed.
Okay. Mr. Secretary.
I would just go ahead and make that motion that we move to executive session
For the
for
purpose of legal.
discussing that legal.
All right, thank you.
Second, Mr. Chairman.
There's a second. It's been moved and seconded, moved by the secretary, seconded by the auditor. All in favor signify by saying aye.
Aye.
Thank you. Madam Director, I think for I'm first off, the work you've put in is remarkable, and I thank you for it. We're obviously presented with a set of circumstances where we have several projects that are have gone through the process, some that are still walking through the process. We're looking carefully at doing a best job, as I explained during our working session. We don't want to sort of blow our bank account on the first go. And so, Madam Director, I think we're going to try to, I apologize for the sort of working nature of what we're going to do, but I know people have made a long trip, and we do feel that it's important that we actually get business done today in terms of being able to fund some things. So let me just open that up to members of the board if there are some things. Mr. Secretary, I don't know if you have any comments you'd like to make.
Thank you, Mr. Chairman. I do believe that we're going to get through some stuff here today, and I know working on this original list, I don't know how you feel, but that maybe before we actually get into it, that maybe we take some of that public comment and from that, and then we start working on them, because I don't know how we're going to get into some of these until if they're here, I'd sure like to hear them.
No, thank you, Mr. Secretary. Madam Auditor, comments?
Sure, Mr. Chairman, and I, again, thank you everyone for participating in this process. We are admittedly building the plane as we're flying. And we forgot a wing back there, but we'll get it on there. And I think the intent today is to, fund some, like the Secretary mentioned. Not being funded today is by no means a vote of no confidence. The situation we're in is, you all know we had that huge list of sort of still hammering out eligibility. Those projects did not necessarily come off of that list in a priority order. It is simply that, there is a funnel, and the staff have been working around the clock, but there's a funnel that they couldn't all get on that list. So, as a board member, it's a little bit of a challenge to fund things without having our whole population and understanding what our whole population is. It could be that everything on this list ends up getting funded, or maybe not in the future. But just that's where I'm coming from as a board member. That to me, not funding some of these today is absolutely not any indication that they won't be funded in a month. That's all, Mr. Chairman.
Thank you, Madam Auditor. Mr. Treasurer, are there any comments you would like to make?
Just that I hope we move forward and get some of these out of here.
Thank you, Mr. Treasurer. Madam Director, I think we had the opportunity in executive session to kind of cover some of the legal implications and aspects of the program as we understand it, and I just sort of trying to make sure that we're clear again, as the auditor said, if there is and this, for the audience, I don't want to make this seem more clumsy than it is, but it may be a little bit clumsy. Our intent here is if that something doesn't get funded today, we're hopeful that we are able to bring it back for consideration. And as kind of a heads up, we are looking at maybe taking a different day in December where we can spend an entire day working on this, as opposed to, trying to do it in 2-hour segments and have people have to make all the travel they do. So, Madam Director, anything you or Ms. Blackwell or Ms. Sewell want to add to this?
Mr. Chairman, I just wanted to thank everybody, the applicants, for their patience and all. I realize this is a completely different program from CARES. There's a lot more work that goes into the justifications and understanding the sideboards associated with the program. So I realize that there is some frustration out there with the applications, and why am I on the eligibility consideration list and not on the ready for board consideration list, and we are committed to continue to work with the applicants and move folks over to the eligibility or ready for consideration list as soon as we're able to, but realizing that this is a laboring task, if you will, and some of it's legal analysis from our legal folks as well. So I just wanted to, again, say thank you for everybody's patience, and we will continue our diligence. And if we have another meeting lined up for December, again, we're going to work our hardest to get as many, at least to the background decision-making, to get these before the board that we can.
And did I see that USDA was here? You may feature large in some of these discussions. Good to see you, Lorraine. And I'm trying to remember who your successor might be. Okay, great. Thank you. Thank you, Brenda. So with that, members of the board, how would you like to proceed? Carl, the secretary had asked if we might have a couple of public comments to start with. I'm happy to do that. My sense also, Mr. Secretary, is that as projects come up, I want to make sure that we have the opportunity for proponents either online or in the audience here to have a chance to speak to them. But you were thinking of maybe some general comments, questions or whatever.
Mr. Chairman, again, at your pleasure, whether we want to have them come up at the time that we come to them, or if they're here, if they want to, if you want to do it before, and then we get into it, however you think is best.
Okay. So we have a list in front of us, which is applications ready for board consideration. It's dated November 14th. Members of the board, does that comport with the materials that you have in front of you? Yes. Okay. What's your pleasure? You want to go top to bottom, bottom to top, top to bottom? Okay. Madam Auditor, I think the first up on my list is the Riverton Medical District, new hospital and clinic for $10 million.
Mr. Chairman, I would move funding for Riverton Medical District in the amount of $10 million for new hospital and clinic.
Okay, that motion has been made. I actually was anticipating, Auditor, that we'd have this up and maybe some discussion about it.
Gotcha. Okay.
Before we went to vote. Is that okay?
Yes, absolutely.
Okay.
That's what I assumed.
Very good. So what's before us is the Riverton. You're going to second it. Okay.
Now that it's on the table, we can discuss.
Okay. So is there, Ms. Blackwell, is there anything particular you want to talk about with this? You've done the diligence, and Mr. Miller's done the diligence as well. If there's anything you want to add color to this before we bring people up to talk to it.
Mr. Governor, board members, the one thing I would say is the Riverton applicants have been very proactive. They were reaching out to us before we even had our meeting last week to discuss what needs to be done with applications. I think that's the main thing.
Okay, thank you. Mr. Miller, is there any, you don't have to, wherever he is. If there's anything you have to add, no. Okay. With that, I see Mr. McGuffey's here, and I also want to recognize Chairman St. Clair, Chair of the Shoshone Business Council. So. Mr. McGuffey.
Good afternoon, Mr. Chairman and board members. My name is Court McGuffey. I'm board chair for the Riverton Medical District. I appreciate you taking the time today to consider our project. With me, representing Fremont County, are the other members of our board. And also, as you just mentioned, Chairman Sinclair, Chairman of the Eastern Shoshone Business Council, and Mitch Goplin, the Vice President of Facilities for Billings Clinic. Mitch is also our owner's rep and in charge of the design and construction of our facility. In 2018, it became clear that hospital services that Riverton, the Wind River Reservation, and surrounding communities depended on would not be returning, and therefore our group set out to build a new hospital. Tolerating 1,000 life flights a year and charges that were over 500% more than the state average, and most importantly, living in constant fear of medical insecurity was not an option any longer. The past 4 years has been highlighted by 3 major accomplishments. The first being $6 million of equity that we've put together as a community. We've raised $1.5 million from our community. We helped pass a half-cent economic development tax in Fremont County. The hospital was a huge driver of that and a big reason why that tax initiative passed. The city of Riverton and Fremont County has given us over $1 million of that money for this project. And the Eastern Shoshone Tribe has graciously donated $2.4 million in land and infrastructure improvements where we plan to build the hospital. I'm very proud of the relationship and partnership that we've developed with the Eastern Shoshone Tribe and all of our Native American residents in Fremont County. And this hospital is just as important to them as the lack of services has affected them just as much. Secondly, we secured a $37 million direct loan from the USDA this past spring. It's the biggest USDA community facilities loan in Wyoming history. The Director Polly and Lorraine are here today to vouch for a few things. The national office said that they've never had a project in the whole country with as much community support as ours. There was almost 300 letters of support for our project submitted. And also, the national office said they've never seen a more thorough and complete application. So we're pretty proud of that. And the third thing was 2 years ago, we started a partnership with the Billings Clinic. And this was the shot in the arm that our group needed and gave us the confidence and know-how to move forward. While we'll maintain local control, Billings Clinic will not only manage day-to-day operations and provide doctor and nurse recruitment, but they'll also be our owner's rep for design and construction of the hospital. And that brings me back to Mitch Goplin and why we are here today. 2 years ago, when we showed Mitch our design, there was about 47,000 square feet. We were pretty proud of it. And Mitch looked at it and said, "This isn't going to work." He said it really nicely, but we were pretty disappointed. And he just said, "Gone are the days of traditional hospital construction. There's this thing called COVID-19 and it's here to stay. And we have to change the way we design and build healthcare facilities from here on out." And Mitch started rattling things off like surge space, flex space, isolation rooms, negative pressure rooms, touchless and cleansable surfaces, adequate ventilation, air handlers, and increased air exchanges, to name a few. Now, last week, the secretary mentioned wanting to see what additional entrances into the a hospital would look like. And we put one in our application, but I've brought some with me today. Secretary Allred, if you'd like to see, but we had to add 2 additional entries into our hospital, one for staff and one for the ambulance. And just in an effort to keep sick patients isolated from healthy patients and staff, because keeping staff healthy during COVID was just as important. It's all about flexibility and adaptability. Those are words that Mitch pounded home to us. And because of these additions and changes, due to COVID-19, our design grew to over 70,000 square feet. and so did the associated costs. And that is why we're making application for this grant to cover these costs COVID-19 has added to our project. In closing, we have so many people to thank that have helped us get to this point. Too many to name, in fact, but I do want to let everyone know how proud I am of our group's efforts. And to me, it goes back to these things called cowboy ethics that our state lives by. In this quest to improve healthcare, we have lived every day with courage. We did what had to be done for our community. And today we're here to finish what we started 4 years ago. So Mr. Chairman and Board, we thank you for your consideration of our $10 million ask. And with that, I'll take any questions the board might have.
Thank you, Mr. McGuffey. Are there any questions? Mr. Secretary.
Could I see those drawings that you have? They're not in the application part that I received.
Thank you. All right, follow up on that. Further
Yeah.
questions?
Oh,
Oh, yeah, please go ahead.
Okay.
I'm sorry, Mr.
I
McGuffey.
was just gonna, this didn't turn out as big as I would have liked, so, but you can see, you know, traditional hospitals, a main entry and an entry into the emergency department and a supply and shipping entry, but, you know, we've added staff entries and an ambulance garage as well. And, you know, so now we have a total of 5 where you might have 2 or 3 in a normal traditional situation. And it's all about being able to be flexible and adaptive and be able to handle those times when, you know, things are busting at the seams, and you got to be able to adapt.
Thank you, Mr. McGuffey. Any follow-up? None? Further comments, questions? Mr. McGuffey, I have an Irene Archibald on Zoom. Mr. Bump, I would recognize Ms. Archibald.
Yes, I was just wondering on your sheet of those projects that have already gone through the approval process and seem to be ready for funding, how the score is determined. It just seemed, you know, Riverton had a 3 score and everybody else was in the teens. And I thought maybe somebody could answer that question.
Happy to. Thank you very much. And so Ms. Blackwell, and then just because I like doing this to the auditor, I know the auditor has spent quite a bit of time reflecting on scoring. So fair warning, Madam Auditor. Ms. Blackwell.
Mr. Chairman, board members, the Riverton board, they related to financial ability since they are new. They didn't have historical financials for us to give them any points for that. They got a point for their match funding. They received 2 points for the source of match funding since they're taking out a large loan. Status of match funding at the time it was pending. Historical investment, they did not receive any points since it hasn't been built yet. The availability of similar services, they got 0 points out of 3. Type of services that they provide, all of our critical care hospitals received a 0 as they are critical care hospitals. And then the need was also a 0 since there technically is another hospital within the town.
Thank you, Ms. Blackwell. Auditor, I know you and I have had a couple of conversations regarding the scoring. I know we put our best efforts into it, and I really want to compliment the staff for doing that. So I don't know if you have any particular.
Sure,
comments
Mr.
you'd like
Chairman,
to
in
make.
particular to this one, and I think we will see as we move forward that just based on the way the ARPA funding works is that the mental health projects naturally score higher. They check more of the boxes. So I think that's why you see a lot of those today. I'm guessing that some of the ones that move off of that other list will also probably have pretty low scores. We passed the scoring rubric as one thing we could look at when we went about these funding decisions, not knowing if it would be very, very useful or not that useful. I think we discovered in the water sewer process that it was maybe less useful than we anticipated. And I would say, and again, it was good work and we approved it, but I think it's maybe becoming even tougher to utilize here. And in specifics to the Riverton Medical District, because they did not exist before, a lot of the categories put them at a huge disadvantage. Like one of them is, can you provide 10 years of or financial records? Well, of course they can't. So there you go.
Thank you, Madam Auditor. Other questions? Mr. McGuffey, I do have a couple of questions. One is that, and I mentioned USDA, great being here, and you, I think, also talked about USDA being a big part of this project. I think one of the concerns for us with a large project is just understanding the urgency of it. It's important to be able to get to work quickly, but just for information, is the USDA loan time sensitive?
Ours is yes. We were awarded that loan in April of last year, and we have a year to get started. Now you can apply for extensions, but that's something that is not a good thing.
Fair enough. Okay. Other questions? All right. Well, it's been moved and seconded, placed on the table to consider. And so with that, what is the pleasure of the board? I guess we will take the vote. All in favor signify by saying aye.
Aye.
Nays? That motion carries. Congratulations.
Thank you.
Thank you.
Thank you.
The next item we have is, and I just want to make it clear because there's some sensitivity to a couple of these projects. I know sublet is also in queue, which is a bit of the reason why we talked about what we were doing beforehand. And sublet also shares some of that USDA funding. And so again, the fact that it's not being considered here is in no way a reflection of what this board may do or not do in the future. We're very, very concerned about all these projects. The next matter to come before us is item 1010, Volunteers of America, Northern Rockies, Wyoming Regional Crisis Stabilization Project. Let me just state for the record, I believe as chair I can run this, but I am a former board member of Northern Rockies, so I'll be silent on this matter. Mr. Secretary.
Mr. Chairman, I noticed because we have 3 projects with Volunteers of America, I was wondering if we could hear from that. I mean, I have an idea on a motion, but I would like to hear from them on all 3 together, and possibly could take care of it with one motion. But if we could hear from them, if they are here, and get some information and consider the 3 of them as far as for discussion.
Thank you, Mr. Secretary. So for the record, then, that would be item 1020, which is priority 1 of 4, SMH, Empath, and Crisis Stabilization Unit for $5,902,000. No, I'm sorry, wrong. This would be, I'm sorry, wrong. 1010, Southeast Wyoming Regional Crisis Stabilization Project for $2,922,700. And then item 1100, Northeast Regional Crisis Stabilization Project, 2,194,992, priority 2 of 3. And then Volunteers of America Northern Rockies Gathering Place Women's SUD Treatment, priority 3 of 3 for $922,000 and 145. Is volunteers, oh, there's Heath. Thank you, sir.
Thank you, Governor, Board. Thank you for having us today. Yes, I realize it's been a process and how we bring these applications to bear. We brought 3 separate applications in. As I walk into this, we currently operate a residential crisis stabilization program here in southeastern Wyoming, serving Albany, Platte, Goshen, in Laramie County. That program has been contracted with and operated under the Wyoming Department of Health for a multitude of years. We acquired that program in an acquisition with Peak Wellness Center. And as we've looked at how to operate a more effective and more efficient service that supports law enforcement, supports the community, supports the hospital, and ultimately helps the client rapidly engage with services, it is our priority to relocate that center from a very substandard and aged rental into a location within and next to our mental health center over on Seymour here in Cheyenne, which would allow a more efficient and effective access point, as well as increase the continuum. I think it goes without saying at this point that what we know about behavioral health and the behavioral health need changed greatly on March 13th of 2020, and we are seeing more and more highly acute individuals. We are seeing more diversion from a hospital environment. What we know about residential crisis stabilization that's community-based is that those individuals are individuals who may not require hospitalization and are able to remain up to 30 days. Now, the basis of that project is to have our supported housing as well as our severely persistently mentally ill individuals housed within the same facility where we can be more efficient with our clinical resources. Without spending much time on workforce right now, the efficiency for us, the efficiency for the state, and the efficiency for the client is to have all those services in one location versus transporting them all over the community and moving them for group and disturbing them. So this is an existing program that we are looking to relocate, address safety, address access, and have it included with our full continuum of care next to our clinic. For the sake of time, the second application is for 12 beds attached to the Gathering Place, which is our women's residential facility in Sheridan, Wyoming, located on our Human Services campus. That program currently has more contracted beds than we have space for. And as we look at how to best take care of women in crisis and women who are sitting in jail and women who have children, that facility allows us to bring children in with the client once clinically appropriate. And this space will allow for us to serve the needs of the Department of Health, the Department of Corrections, and our other partners within an existing building versus adding a new one. The third project that you have before you is crisis stabilization beds, community-based crisis stabilization beds located in Sheridan, Wyoming, attached to the Life House, which is a 50-bed men's high-intensity treatment center. There is value in being able to be on the front end of managing crisis. As we look at how to best address changes within behavioral health in Wyoming, those continuums are going to need to be focused on the most highly acute care. And what we're learning right now is that we are serving individuals. The needs in Wyoming are requiring us to serve individuals who may not be appropriate for existing structures, but may be the only option available out there. And so we have none of those services available currently in Sheridan. However, we do have the contract we're already under contract to provide those services should the space to do it in be provided. This is an opportunity in all three of these projects to position Wyoming and to position the system to deliver care. One of the greatest gifts we have right now in this state is the ability for the state to set policy related to behavioral health and for the providers in the community to collaboratively come together and provide the space. And so with that said, that is the purpose behind the three projects that are there. I know this is quite the process for you guys to walk through, and I appreciate the patience and the opportunity for multiple justifications and engagement with the staff. They've been very responsive, and I'm grateful for that.
Thank you, sir. Questions? Mr. Secretary.
Yeah, thank you for that. Question for you on this one, the gathering place, the women's substance abuse treatment. Do you know what your recidivism rate is on those?
I know that our successful graduation rate today is running about 83%. We are required under contract with the Department of Health to have that number at 65%. Nationally, that trend tends to run about 48%. I believe that the services there are producing strong results. Unfortunately, I don't know that any of us know what recidivism rate and recovery looks like 6, 9, 18 months out. But what we do know is the folks that have the tools are more successful at graduation.
Please follow up.
Just a comment, because I know in dealing with a lot of this in the past and things, one thing is when they go back into the same environment that they came out of, whether it's friends, acquaintances and things, that they tend to go back into that behavior. I know of ones I've dealt with, the most successful are those that cut all ties with everything that they have and move, go somewhere else, as far as being successful. And that is just, going back into that same, that's just a concern that I have.
Please.
Governor, Secretary, I believe that you are 100% correct that in recovery and that impaired attempt at a full life when working with that addict requires the severing of ties, but it also requires the building of community. And so aftercare and engagement and meetings and having a resource to reach back into is where I believe, along the lines of whether it's Celebrate Recovery or Ministry or AA or NA, that well-defined plan is critical. I also think that's why this continuum is so important. As you look at our campuses and where this building is being located, a visual would demonstrate recovery homes as well on the property, would demonstrate ability for children to be served, would demonstrate an opportunity to address trauma, particularly with this group. But I do not disagree with you that new habits are absolutely necessary regardless of environment.
Thank you. Further comment? Anyone online? No one online? All in favor signify. Oh, wait, we have a motion we have to have, right? I'm sorry, Ms. Blackwell.
I do want to mention that application 1100 and 1101, we'll still need to work with them on the match funding. I think we can lower the price of the overall project. It's just going to take a little work. So just all cards on the table.
Thank you. Thank you, Ms. Blackwell. Sorry, I got ahead of myself. Anyone else want to address? Pleasure of the board.
Mr. Chairman, considering that Ms. Blackwell had made that comment about that match, and we definitely can consider it later, but I would move that the 1010, that we approve that one. And yeah, either in the same motion, or we could consider that later as far as tabling the other two.
Okay, so is your motion then to put 1010 on the table for us to consider right now?
Yes, Mr. Chairman.
Okay, thank you. Is there a second?
I'll second.
It's
Mr.
been
Chairman.
seconded. Okay, discussion? Hearing none, all in favor signify by saying aye.
Aye.
Congratulations. Do you want to deal with, since it's appropriate now, let's deal with 1100 and 1101? What's the pleasure of the board?
Move that we table those to our next meeting.
That motion's been made to table. There's no discussion. Is there a second?
Second.
It's been seconded. All in favor signify by saying aye.
Aye.
That motion is tabled to a future meeting. Thank you, Heath. All right. Now we're at item number 1020, ARPA score number 1020, Memorial Hospital of Sheridan County, SMH, Empath, and Crisis Stabilization Unit, priority 1 of 4 for $5,902,556. Is there anyone here or online who would like to address the board for Memorial Hospital of Sheridan County? Please, come on up. Yeah, good to see you, sir. Thanks.
Mr. Chairman.
Yes.
As he's coming up, I see that on our list here, we have 2 for Memorial Hospital of Sheridan County. If we could just discuss both of those at this time.
Sounds good.
Sounds
Okay.
good. Mr. Chair, thank you very
Yep,
much.
thanks.
So the two that,
And you might just say who you are. Go for it.
I'm Mike McCaffrey with Sheridan Memorial Hospital.
Thanks.
I'm here to represent two of the 4 projects that we've submitted applications for. One is our Empath and Crisis Stabilization Unit, and another one is our Emergency Department Triage Project. To start with the Empath and Crisis Stabilization Unit, this is a project that we've been working on for the last couple of years that is really buttressed by the support that we have from our regional partners, not only in Sheridan, but in Johnson County, as well as other, providers and systems of support, such as the legal system and law enforcement. So, we really came about this project kind of through the needs that have been accumulating over the years. In the past 2 years in particular, we've seen a 20% increase in emergency detentions through the pandemic. And that really gets us taking a hard look at our capabilities and our ability to take care of people in our community. Currently, we have a 50% transfer rate for those involuntary holds as well. That's up from 35% 2 years ago. So we can see a trend of increasing number of involuntary holds along with an increasing number of transfers from our community hospital. What we're seeing is a lot of people coming in through the emergency department that are in need of psychiatric evaluation and treatment. And we kind of combine this with a fractured system of care in our region in particular around clinical infrastructure and clinical support, physical facilities for the clinical needs of these people. Those two things kind of add up to a lack of timely and effective care for behavioral health patients in our region. And so what we've really tried to do is look at a program that is, or a project that is a proportional response to the needs of our community, given the services that we anticipate for the future and the future growth of these populations. So what we really tried to do is set up the physical and clinical infrastructure to take care of the needs of these patients with the idea of having some outcomes from all of this. empath stands for emergency assessment, treatment, and psychiatric assessment, treatment, and healing. And basically what that is it provides a system of care that is more than just coming into an emergency department and being placed with what's called the Title 25 or involuntary hold. And what we hope to do is change the system of care and the outcome of care for these patients so that we can decrease the number of involuntary holds in our region, decrease the number of transfers to places like Wyoming Behavioral Institute and the Wyoming State Hospital. We hope to reduce pressure on our emergency department. We hope to expand capacity for behavioral health services across our continuum and implement strong community awareness around mental health, along with this growth in psychiatric care within our community. We also see introducing a new front door for patients with behavioral health issues that would be able to come into our hospital to receive treatment on an outpatient basis with crisis stabilization, rather than coming in an emergency situation, in an acute situation through our emergency department and providing a different level of care with community partners to be able to do that. We're able to utilize space within our existing facility to be able to accomplish this project. We have another look at this that is a much larger build out, and we chose to go with one that is appropriate and very proportional to the needs of our community and the future needs. And so that's the first project, and that project is about a $12.8 million project. We have great community investment and partnerships to support the match, and we're requesting $5.9 million from the Slib board in consideration of this project, 5.9 million to 556. Okay. The second project is our emergency department triage. In 2004, we designed our emergency department, and at the time, it was a great complement to our facility. Over the past 20 years, a lot of things have changed. In particular, over the last couple of years, things have changed regarding how we bring people into our facility and how we separate out people with respiratory disease, people that are coming in for, burns or other types of things. And I think the idea here is to create an environment where we can bring people in and get them to a place that is segregated out from kind of an accumulation of respiratory disease in one waiting room. So we've created a number of triage spaces and a better flow of patients through this new front entry space for our emergency department. Currently, we don't have access to that, and we have, over the last couple of years, put up a lot of walls and barriers to keep people segregated with respiratory disease. Now, with this new project, we're able to put people into different spaces that have negative air reverse isolation for those people to separate them out so they're not spreading disease. We also have a space at the front of the emergency department that creates isolation for highly acute and violent behavioral health patients as well. And we've added that into our project. And that project is a $960,000 project, and we're requesting $480,000 from the Slib board.
Thank you. Questions?
Mr.
Mr. Secretary, then I'll see the auditor. Mr. Secretary.
Thank you. Appreciate that. I have a couple questions really quick, but where you're saying right now, currently you're transferring out about 50% of your people. If it's resident, I mean, basically inpatient, they're admitted on a psychiatric deal. Isn't that better for them to go to a psychiatric hospital where there's a little more, I guess, what's the word?
It's a
Expertise,
great question, and
rather than
that's
putting
exactly
them
right.
inside a hospital that I just consider that being more medical treating there. So if they have something that's identified as a psychiatric issue that requires some residential or staying in there for a while, isn't that better going to a
Absolutely,
psychiatric?
absolutely. And you've kind of hit on the crux of the problem within our state. There just aren't enough psychiatric beds available for the treatment of our population. And so we might have somebody in our facility that is in need of going to the Wyoming State Hospital or Wyoming Behavioral Institute, but they're on a waiting list. And that waiting list might be up to 14 days before we can get them where they need to be, which makes us then a holding facility for that patient during that process. What we're proposing is that we create a physical space and the clinical infrastructure to support being able to provide them with the level of care they need immediately, timely and effective care within their home community.
Follow up on that.
Please follow.
Follow up with that, is it just those two facilities here in Wyoming, or is there available a facility in Billings or something? I know as close as you are to the Montana border, that's
Sure, there are a lot of
Do they have some
complications with that. If somebody's put on an involuntary hold under the statute, they can't cross state lines. And so that becomes a problem for getting a placement in a place like Montana and Billings. There are other places that we send patients to. We send them to the Gillette Hospital. We've been known to send them to the Laramie Hospital or the Cheyenne Hospital. Each of those hospitals have behavioral health units, or a few beds anyway, to be able to care for patients. And so it's very, very challenging in terms of disposition of patients every single day that have this disease.
Thanks.
final question.
Oh, sure.
Okay. Last one on the other project, your emergency room triage, and I wish we had kind of a drawing of what you're looking at, but this is existing space, you're just repurposing that
Correct. And
for
I'm sorry, I'm going to.
addition.
I apologize. I thought this was
Great.
within your packet.
Okay.
That's the new finished space.
So what is in this area right now?
So in that area right now is basically a waiting room and admissions desk, and we'll be taking that space and creating triage and isolation spaces for patients. So we get them out of the emergency waiting room immediately into those triage spaces.
Thanks. Madam Auditor.
Mr. Chairman, thank you for being here. So these types of services, my understanding is that they don't bill well, for lack of a better term. They're not money makers for the hospital. They're there because you need them. And so talk to me a little bit about how the continuing operations and staffing, can you do it? Are we, I think we all want to be cautious about investing in something which is great now, but is not sustainable.
Right. Yeah, it's a great question, and I think the answer that I have is that yes, our plan is to do this, and we believe that the system of care we provide is sustainable. The individual service line is certainly not sustainable, but it's a need for our community. It's a great need. It has been for a long time, and it's growing, and we've seen that growth over the last couple of years. Just to give you an example, Sheridan Memorial Hospital is a county memorial hospital. We are responsible for the care of our community, subservient to our county commissioners, and our county commissioners appoint a board of trustees. The county of origin for any of these titled patients is the payment for the care of the patient. The first 72 hours is the responsibility of the county. Okay, the county provides us with around $240,000 a year. Our costs to provide that level of service are closer to $2 million a year. So currently we are subsidizing county government to provide these services. We believe that by increasing the amount of services, the clinical care we can provide, we can decrease the number of involuntary holds, which means that we can have these people back into the mainstream more quickly and maybe not having to be in longer term facilities for their treatment. So the system of care that we're trying to put together is a more effective financial system of care for the systems that are implementing them.
That's all,
Follow-up?
Mr. Chairman.
Any follow-up?
And to that, and I'm sorry, to that financial point, right now, the resource burn that we have on holding a patient that is not receiving treatment is substantial. If we're holding somebody for 10 to 14 days, that means we have facilities, nursing staff, all kinds of things in support of that patient's essential detention rather than the treatment.
Thank you.
Thank you. I would note for, I think both the treasurer and the auditor, you may remember the support that came from Johnson County commissioners and Sheridan County commissioners for this project. And I say that noting it's no conflict of interest. My wife used to be a med tech at Sheridan Memorial Hospital. So anyway.
Just a follow-up,
Mr. Treasurer.
Yep, looking at this one here, your emergency one, you've got, looks like 4 triage units, and is this, is that's in the same place as the $6 million project here? And
No, it's a good question. So the emergency department is on the east side of our campus, and the behavioral health unit is on the west side of our campus.
I'm just wondering whether or not the people that are triage, do they don't go to the other facility on the other side of town?
Depending on severity, it could be that we have a lot of different people that come in. So we might have law enforcement bring somebody into the emergency department who is in a bar fight or is violently psychotic, that needs to go to the emergency department for stabilization versus going through our new front door urgent care where they might be at a different level. And that'd be on the judgment of the people coming in. They might be a walk-in or law enforcement might bring them in. We'll still need access through the emergency department.
So triage of a patient would take normally how much time?
It just depends on what the circumstances are. It might be that they just need a procedure room to get opened up or an exam room, or they might need to go immediately to x-ray. It just depends. Usually it's a quick consultation with a provider to get them where they need to be.
So these are both physical and mental triage centers?
Yes. Yep.
Okay, thank you.
You bet.
Thank you. Other comments? Other comments, questions? What's the pleasure of the board?
Mr. Chairman,
Madam Auditor.
I would move approval of project number 1020.
Okay, that
To-
motion, go ahead.
Yeah, in the amount of $5,902,556.
Okay, that motion's been made. Is there support for that motion? It's been seconded by the treasurer. Any discussion? All in favor signify by saying aye.
Aye.
That motion carries.
Mr. Chairman,
Madam Auditor.
I would move to table project 1024 to our next meeting.
Is there support for the auditor's motion to table to the next meeting? That's been seconded. No discussion. All in favor signify by saying aye.
Aye.
That motion carries.
Thank you very much.
Thanks very, very much. And safe travels home. The next project on my list is item ARPA number 1058, Weston County Hospital District, Newcastle Rural Health Clinic Upgrade for $873,883, priority 2 of 3. Is anyone here from Newcastle Rural or from Weston County Hospital District? Is there anyone online? I think we have Maureen. Ms. Cadwell, good to see you online.
Yes, thank you. Would have ventured that way, but it's snowing up here pretty much all day. So
Well, you guys are so lucky you get snow all the time.
well, we need the moisture. We'll take it. I'll talk about the Newcastle Rural Health Clinic first. This became owned by us as of July 1st of 2021, kind of bringing our medical services all under our umbrella. which has been a very positive move for our community. This upgrade would upgrade the facilities HVAC systems, as well as provide a separate space for individuals who are requiring separation due to a respiratory illness or other situation from the main entrance of the clinic. The building is over 30 years old, so there's quite a bit of work that would need to be done on the infrastructure for that HVAC upgrade. And so it is a pretty substantial project.
Ms. Cadwell, and just for the folks here, you're speaking about the item on renovations of nursing home and upgrade of HVAC?
I'm speaking on the 1058, which is the Newcastle.
The clinic
Health
upgrade.
Clinic.
Okay, thank you. Yeah, and very good. Thank you.
Yeah, Mr. Chairman.
Yep.
In item 1060, it's also described as the Upton rule. Oh, this is Upton, not Newcastle. Okay,
Right,
great. I'm
right,
fine.
Right.
Yep.
And Ms. Cadwell, I guess following the order that we've done, I guess we can consider all three of these. So on item 1058, are there any questions while we're there? Hearing none. 1059, the renovations to the nursing home.
Yeah, thank you, Mr. Chairman. 1059 is a renovation to the nursing home HVAC systems. A few years ago, I think you and maybe others of the committee remember we did a significant renovation of our entire facility, but the HVAC system in the nursing home was not included in that. And some of our issues that we've had with this system, besides being dated, is that all of the venting and all of the filtering for the systems are all in the roof ceiling of the facility. And it requires substantial work for our staff to go up and change the filters and work on the systems. And so looking at our HVAC and trying to make it better for all of our residents as far as the air quality and the capability of being able to work on those systems, we've come up with a plan in order to replace that system within the nursing home.
Thank you. Any questions? Mr. Secretary.
Just a quick question. How many residents do you have in this nursing home? How many beds does this cover?
Sure, Mr. Secretary and committee. We've got a license for 58 beds in our nursing home. We are currently at 39 residents, basically due to staffing levels and the struggles I think every healthcare entity across the whole United States is struggling with.
Thank you. Further questions? Madam Auditor.
Mr. Chairman, I have a couple, but they may be for staff. I don't know if you want me to hold off on that.
No, if you want to proceed, maybe now's the time to do that.
So, Mr. Chairman, I thought we had given CARES money for the nursing home HVAC upgrade.
Madam Auditor and committee, I can answer that. We did submit a grant for upgrading the HVAC in the nursing home, but we turned that back in because of the timing of the being able to get it completed by the end date.
Thank you.
That was my memory. Yeah, the trouble with CARES was the timing issue and you couldn't
Exactly.
complete the
Yes.
project. Further question? No, we're good. Okay.
Yes,
Yes,
Mr. Chairman,
I'm sorry,
sorry,
Madam
actually,
Auditor.
and this may be for our, the good AGs. Do any of these qualify for the narrow rural health clinic funding? All of them?
That staff is indicating they're thinking that it does. Ms. Cadwell, I think there's a little discussion going on with the attorneys now. Mr. Miller.
Mr. Chairman, Madam Auditor, I believe that both clinics qualify as rural health clinics for that $13 million pot of money. I do not believe that the nursing home qualifies.
Thank you, Mr. Miller. Further questions? Okay. Ms. Cadwell, I think that brings us to 1060 for the Upton Rural Health Clinic Upgrade HVAC Infection Control System.
Yes, and this is very similar to the Newcastle Rural Health Clinic. This building is probably over 40 years old, and of course serves those residents in the Upton area. It too needs upgrade to the HVAC system, as well as separation for patients to come in who have respiratory or other issues that need to be separated from the general population.
Mr. Chairman,
Mr. Treasurer.
I guess a question for our attorneys there, that if the nursing home had an Alzheimer's unit, would that qualify in part then?
Mr. Chairman, Mr. Treasurer, we're referring to the behavioral health money set aside, narrow funding, or?
Yeah.
No, Mr. Chairman, I don't believe it would qualify. I think those are for crisis stabilization units
Okay.
and women's substance use disorder
Oh,
treatment
narrow,
facilities.
narrow. Okay.
Even more narrow than just general behavioral health.
Yeah, okay, thank you.
Thank you. Further questions? Thank you, Ms. Cadwell. What's the pleasure of the board?
Mr. Chairman,
Mr. Secretary.
since we're talking about the two that are rural health, I would move to approve both of those two.
I would second, Mr. Chairman.
Okay, that motion's been made and seconded. Is there any discussion? All in favor signify by saying aye.
Aye.
Items 1058, the Weston County Hospital District, Newcastle Rural Health Clinic Upgrade, and 1060, Upton Rural Health Clinic Upgrade HVAC Infection Control System have both passed.
Thank you.
Thank you.
Mr. Chairman, I'd move that we table the 1059.
Second?
That motion has been made and seconded. Is there any discussion? There is no discussion. Sorry,
discussion on
table. All in favor signify by saying aye.
Aye.
No.
That motion carries with 2 ayes and 1 no.
We need 3, don't we?
Well,
Mr.
Yeah.
I believe we need 3 affirmative votes for a motion. to
then I'll give an affirmative vote on that. Okay. We now move to, there are 2 West Park Hospital District, Cody Regional Health, items 1061 and 1062. Central Sterile Department, AHU renovation, AHU replacement project. Is there anyone here from Cody? Anyone online? I have Kim Jacobs. I'll recognize you.
Good afternoon. Thank you, Mr. Chairman. Our Central Sterile Department renovation project is pretty important to our facility. The price of construction has actually gone up. It's doubled in the last year. So that's why part of the need for a request. With the pandemic, the need for an upgraded space was highlighted to meet the increased needs the hospital and its associated clinics required due to COVID-19. We continue to struggle to support the pandemic-induced surge in volumes and types of equipment in need of sterilization, and we don't anticipate these issues to return to pre-pandemic levels as COVID-19 and its associated protocols are here to stay. We've seen a dramatic 75% increase in pulmonary function testing, which is a crucial diagnostic evaluation tool for patients with lung disease. The numbers continue to increase due to continued COVID outbreaks and the after effects of COVID on patients' lungs. We have implemented new protocols to increase safety because transmission of COVID-19 infections can occur if this equipment is not sterilized properly. and the current central sterile department is not able to handle the increased volumes or types of equipment needing sterilization to meet these COVID-generated needs. Also part of this project is an air handling unit, which air handling units have been the topics of conversation since the beginning of the pandemic, and they continue to play an important role in keeping patients safe from COVID. The air handling unit in this department is 50 years old and does not meet the current needs or standards that fighting the pandemic requires now or in the future. This department is also seeing an issue with staffing that continues today, and we anticipate to continue into the foreseeable future. The remodel project will provide the space necessary to accommodate new equipment, allowing us to sterilize the higher volumes of equipment discussed and larger items such as airway carts, trauma carts, stretchers, beds, and other larger equipment that is exposed on a regular basis to COVID positive patients. The remodeled central sterile department will assist Cody Regional Health in greatly reducing the risk of transmission of COVID infection, as well as increase efficiency and safety for employees, reducing the number of staff needed. Included in the project is the replacement of the 50-year-old air handling unit with one that will support the necessary equipment. The unit will include high-level filtration, resulting in reduced potential for distribution of COVID-19, as well as UV lights, which are recommended for COVID-19 mitigation. I'd be happy to address any questions about this project, or I could move on to the next one if you like.
Let me stop you there and just ask if there are any questions.
Yeah, Mr. Chairman.
Mr. Treasurer.
Yeah, I guess this would be a question for this one and the next one, is that your AHU, that's your air handling unit replacements. Is there air conditioning in these buildings also? And this is air handling unit is primarily for filtration, but you have air conditioning in them, I'm assuming, or no?
We do have air conditioning in the building. I am not sure if this air handler unit provides that cooling effect.
Okay. All right, thank you.
Other questions? Anyone else want to address anything? Ms. Blackwell, did you have your hand up, or you did not? Okay. Any questions? Okay. Members of the board, what's your pleasure?
Mr. Chairman, I wouldn't mind hearing about maybe both projects from her before we
Okay.
make any motions.
All right. Second project, the 1062 AHU replacement project.
Thank you, Mr. Chairman. Per the CDC, COVID-19 particles spread more readily indoors where the concentration of viral particles is often higher. Protective ventilation practices and interventions can reduce the airborne concentrations and reduce the overall COVID-19 virus dose to occupants, therefore reducing the risk of transmission. Cody Regional Health has an aging ventilation system with 4 of the units being 50 years old, and the 5th is 40 years old. Service life of air handler unit components range from 10 to 25 years. We have experienced recent system failures resulting in an unventilated environment that creates stagnant spaces with no dilution, filtration, or treatment of air. And this can lead to higher infection rates from COVID-19 airborne pathogens. The components are failing and replacement parts are no longer available. The project would replace the 5 air handling units with ones that provide higher levels of filtration as recommended by the American Society of Heating, Refrigerating, and Air Conditioning Engineers for COVID-19 mitigation. UV lights would be mounted in the units, which are also recommended as an air cleaning method proven to kill COVID-19 particles. The added redundancy of components these units supply will result in added insurance against a system failure. The project also includes adding cooling redundancy in the OR air handling unit, resulting in increased reliability in that area. The harm reduction in proceeding with this project is significant as these units serve both clinical and non-clinical areas where protecting patients and staff from COVID-19 is critical in providing quality care in a safe manner. I'd be happy to address any questions about this project as well.
Thank you, Mr. Secretary.
Thank you, Mr. Chairman. Question, and it's kind of along the lines what the treasurer asked on this. I would assume these are full HVAC units that are moving the air through. on this. And with that, is there any of these that are providing a negative air pressure in any of the locations between the two projects, either one?
There's not a negative air pressure associated with this project. We do have areas within the facility that have negative pressure already in place. Our emergency department has 2 negative pressure rooms within it, and this project does replace an air handler that serves that area.
Follow up? None? I do see that a Mr. McMillan wants to address the board. Mr. McMillan, I'll recognize you.
Thank you, Governor and members of the board. So just want to thank you for allowing us the opportunity to present. Kim has done an excellent job in presenting the summary of these 2 important projects. Again, as Kim has stated, both of the projects are critical to the operation of Cody Regional Health. Both projects, as addressed, have really escalated at our organization in need based on the pandemic over the past 3 years, and both of them better prepare and position Cody Regional Health for future pandemic safety and preparedness. We do have Cody Regional Health is positioned to provide the 50% match for both projects. And again, just thank you for the opportunity to present these important projects for Cody Regional Health.
Thank you, Mr. McMillan. And on a personal note, I just want to thank Cody Regional Health for doing such a phenomenal job during the early days of the COVID pandemic. Your willingness to step forward and provide for potential emergency situations when we opened the park 2 weeks before any of our neighboring states did, when everyone else was complaining about having to have a field hospital in there. Your work was outstanding. Your staff and Powell's staff, I just want to compliment you on that and thank you for stepping forward in a challenging time. With that, members of the board, is there any further conversation?
Mr. Chairman,
Madam Auditor.
just to clarify, it's my understanding that these projects actually do qualify, or no? Okay, never mind. Okay, good to know. Thank you. They're not part of any narrow funding stream.
Right. So what's the pleasure of the board?
Mr. Chairman,
Madam Auditor.
I would move approval today of project, oh gosh, I lost it. Oh, here we go. 1061, their priority 1, and the amount of 2775548.
That motion's been made. Is there support?
Second.
It's been seconded. I'll recognize the treasurer. Sorry, Mr. Secretary, you both hit the lever at the same time. So any further discussion? All in favor signify by saying aye.
Aye.
That motion carries.
Mr. Chairman,
Madam Auditor.
I would move to table their priority 2 till our next meeting, project 1062.
Support for the table. Support for the table?
Second.
Seconded. All in favor of tabling 1062 signify by saying aye.
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 Are there noes?
No.
I will say an aye. We will table that. Thank you. The nay was the treasurer. Sorry. Thank you, Bonnie. Sorry. That moves us down to Goshen Healthcare Community Alzheimer's Wing Air Quality Improvement Project, item number 1072. Is there anyone in the audience from Goshen County Healthcare Community? Online? Here online? I don't see anyone. I'm going to call one more time. I don't see any. Okay, Mr. Secretary.
Mr. Chairman, seeing as there's nobody to speak to that, I would suggest that we table this at this time.
Mr. Chairman,
Mr. Treasurer.
before we get a second on the table, I'll speak for this, Mr. Chairman.
Well, okay, let me hold you up because I think
Yeah.
it has to go straight to a second. So the motion was put on the, to table. Is there a second? Is there a second? Is there a second? I don't have a second. Thank you. Okay, Mr. Treasurer.
Yeah, Mr. Chairman, we've tabled one that was a nursing home, and that's the most vulnerable part of our population. And Alzheimer's, I think, are exactly the same. I believe this was in one of the original, was approved in one of the original tranches, the first 25 million that we saw. I think it was, or was it part of that first 25 million? It wasn't approved, but I mean, it was in the
It was in the original
List.
recommended for board consideration list.
yeah, right.
I
in the
believe you are
original one.
correct.
Yeah, yeah. I don't recall whether anybody spoke or whether we had any testimony on it then, but I think it's a relatively small amount of money. It's only $300,000, and it's for those folks that are most critically affected by COVID because of their age and underlying health characteristics. And I believe that it's of any of these type of things, that all of these things that are in nursing homes and Alzheimer's units, it's a critical part of the solution.
Thank you, Mr. Treasurer. Further comment? Mr. Secretary.
Thank you, Mr. Chairman. I definitely see, and like the treasurer spoke, that it's a relatively small amount compared to some of the others. And I would be inclined to approve that. My only thought was that we have a time when somebody from Goshen would be there to speak to it, but I definitely could be in favor of it.
Mr. Secretary, I kind of agree with you. There are people that have made the trip here and knowing that this is not a final up or down, but that we can consider it in time. I tend to approve, to think along the same lines you do. Madam Auditor. You had your button picked?
Mr.
pushed.
Chairman, I had just left it on from the last time I was talking,
No.
but. Mr. Chairman, this is a tough one. I think we'll probably all support it, whether it's today or next month. I don't have strong feelings. And in the interest of keeping things as simple as possible, and I don't know that I can make the same motion that was just made.
To table? No, but you can move for consideration at the next meeting.
Mr. Chairman, I would move for a favorable consideration of this project at the next meeting.
Is there a second for that? Second. It's been seconded. Any discussion? All in favor signify by saying aye.
Aye.
That motion carries, so we will consider that.
I'll vote no and
Right,
say
I'm
that I
sorry.
saw
Yeah.
a very interesting Far Side comic about procrastination the other day.
So, Mr. Chairman, may I ask a technical question?
Sure.
I think what just happened is I made a motion that we fund it, but we not vote till the next meeting, which is different than tabling the ones that we've tabled where there was not a motion made. Is that accurate? Or is it all the
You said you
same?
recommended a favorable consideration at the next meeting.
Yeah, Mr. Chairman, Madam Auditor, I was going to ask what that meant.
It means that we like
Just what I said.
that we like the project, but quite frankly, I'd like to know a little bit about the particulars of it, and so.
We're just telling those folks in Goshen County, if you're going to come here and ask for money, be here.
Yeah, there you go.
But Goshen County is usually very good about being here for that, so. And again, it's not unfavorable in any way. I did say we'd be a little messy today, and I keep my promises. So, that moves us to there is a suite of projects here from Southwest Counseling Service, Jonah Treatment Facility for Crisis Stabilization, Duran co-occurring MH and SUD residential treatment for women, Washakie co-occurring MH, SUD residential treatment for women and children, and Ankeny Treatment and Medical Facility for Crisis Stabilization, MH, SUD residential treatment for women. That's priority 1, priority 2, priority 3, and priority 4 of 4 for Southwest Counseling Service. Is anyone here from Southwest Counseling Service? Is there anyone online? Anyone here from Southwest? I know it's a long drive and it's winter conditions. So do you want to speak on their behalf on part of WAMSAC?
I don't want to speak up, but Ms. Linda Akers should be online.
Oh, there she is. I just saw her hand up and then she disappeared. She's back. Miss Acker, I think you have the floor.
Oh, thank you very much, Mr. Chairman and committee members. First of all, let me say how grateful I am to have this opportunity to request capital funding for mental health and substance abuse providers. It's the first time in my history with Southwest Counseling that this has ever been an opportunity. But with that, the Jonah facility is going to be a treatment facility for our crisis stabilization and mental health and substance use disorders for people in our residential programs. What happened during the COVID, it became very apparent that our outpatient facilities were very close quarters, too limiting for the number of people that were coming into our building. On an average, we have between 175 to 250 outpatient, as well as we have 5 group homes. So the Jonah facility is a donation that we received from Jonah Energy in 2017, and it was mothballed for us until March of 21. And the reason it was mothballed is we were just waiting for an opportune time to move forward with the treatment. And we have placed the modular facility, it's a 4,000 facility, on a foundation. We have, one of the requests of our county commissioners is it had to look pleasant from the outside for people who were traveling on I-80. And we have accomplished that. It's a outstanding facility. And what we're looking at now is getting that facility ready for people to enter it. And of course, you need an occupancy permit, and we have to do the parking lot, the parking lights, and all the interior needs to be done at this particular point in time on that project. But we will proceed forward with that because the demand for our services is increasing as well as the intensity. Do you have any questions on the Jonah facility?
Thank you. Let me ask if there are any questions. All right, Mr. Treasurer.
Yeah, Mr. Chairman, these appear to all be modular, so if there doesn't appear to be enough money to fund all 4 of these, would that just reduce your capacity? But you could I guess I want to make sure there's no interdependence, and I'm assuming there's no interdependence because you have 4 different priorities.
Mr. Chairman and Mr. Treasurer, the only modular is the Jonah facility. Duran and Washakie are actually still stick-built homes. The priority for us is the Jonah facility.
Okay, thank you.
Thank you. Further questions? Okay, let's move on to Duran.
Duran is our facility for women who have a mental health and substance disorder. We also have it's 18-bed facility, and there's 2 staff. And this facility's been online with us for several years, since I think 2006. And it's a large home. And during COVID, we had to restrict the individuals that were in residential treatment to their residence. And so there was a lot of wear and tear on the facility, as well as it has been in use since 2006. And we really do great maintenance, but we do need some really updating of that facility at this time.
Thank you. Any questions? Any questions? Hearing none, let's go on to Washakie.
Washakie is our facility. It came online probably in 2006. And Washakie is a facility for women with their children. It's a 9-bed facility for women, 9 beds designated for children. And one of our bragging points that I'd like to just point out to the chairman and the board members is we have delivered our 126th births in the facility. And it's not only a facility for Sweetwater County, but 53% of our residents are coming from all over the state. And we do see ourselves as not only for Sweetwater County, because you're right, sometimes you do need to get out of the county you're in and go to another county. And so we are a facility that serves all of the state of Wyoming.
Thank you. Any questions? Okay, hearing none. Ankeny.
Ankeny is our treatment for medical facilities, for crisis stabilization, and for substance use for women and children, of course. And it's just a facility that has been in use for a number of years, and we could use remodeling to the bathroom, to the flooring, lighting. The concrete around the building needs to be replaced. It's just time for updates for the buildings at this time. And we have really safety issues that we want to be addressed for not only the clients we all serve, but for our employees as well.
Okay, thank you. Any questions? Okay, hearing none. What's the pleasure of the board? Madam Auditor.
Mr. Chairman, I'll take up one of them at least. I would move that we approve their priority 2, project 1131, in the amount of 647,978.
That motion's been made and seconded. Is there any discussion? All in favor signify by saying aye.
Aye.
That motion carries.
Mr. Chairman, I'd move that we also approve their number 3 priority.
I'll second.
That motion's been made and seconded. This is Washakie, co-occurring mental health and substance abuse, residential treatment for women and children. Is there any further discussion? Hearing none, all in favor signify by saying aye.
Aye.
That motion carries.
Mr. Chairman, I would move approval of the 1134, the Ankeny treatment.
Oh my God.
Medical facility and crisis stabilization for 5/16/701.
Okay, a motion's been made. Is there a second?
I'll second.
It's been seconded. Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
That motion carries.
Mr. Chairman,
Madam
I
Auditor.
would move to table 1127 to our next meeting.
Second.
Been moved and seconded to table to the next meeting. Item 1127, all in favor signify by saying aye.
Aye.
Nays? That motion carries. Thank you very much,
Thank you.
Ms. Acker. All right, that brings us to item 1238, Memorial Hospital of Laramie County doing business as Cheyenne Regional Medical Center, Behavioral Health Services Renovation and Expansion. Is there anyone from, yes, please. Good to see you. Thanks.
Yep.
Yep.
Okay, great. Thank you. Thanks for having me today. My name is Robin Rolling, and I'm the Chief Operating Officer at Cheyenne Regional Medical Center. And we are requesting funding for a new behavioral health inpatient unit. And the total amount of the project is $14.8 million. So we're asking for $7,402,325. This new unit would create 16 general inpatient behavioral health beds. We currently are at 14. And in addition, it would provide for 5 psychiatric intensive care unit beds, or PICU beds, as we call them. As you've heard previously here today in testimony, we've seen a significant increase in the intensity or acuity of behaviors of folks that have been coming in through our emergency department. And so the need for those psychiatric intensive care unit beds is fairly significant. In addition, I do want to comment that our beds are double occupancy. So, and the reason for that is because it helps facilitate safety. So typically, if you have 2 patients residing in the same room, they're able to help monitor each other. So to help avoid or defer any kind of harmful behaviors that they might have. So that's been really helpful. What questions might you have for me?
Well, I'll open it up for questions. Are there questions?
Mr. Chairman,
Madam Auditor?
thanks for being here. How will the hospital move forward if this isn't funded?
If this is not funded, we will not be moving forward with this remodel. Originally, we had planned this as part of our 10-year master plan to participate in creating this behavioral health unit and new space. But unfortunately, given the concerns and the financial constraints that we've incurred through COVID, we just simply don't have the funding to provide for this new unit. We typically operate at a loss in this unit. We see it as an investment in our community as a whole. And we do see, and I think we've heard a lot nationally about the increase in behavioral health challenges. And I think we've not yet quite seen what all's to come as we continue to move further afield from the immediate crisis at any rate.
Mr. Chairman, follow up?
Please.
Would delaying this funding decision by, 3 to 4 to 5 weeks substantially change the outcome or drastically impact the project?
I can't say that it would drastically impact the project, but it will impact the project because every day that we are delaying, we are incurring an increase in cost.
Thank you. Further questions? Further questions? I would note this is one of the higher scoring projects.
Mr. Chairman?
Mr. Treasurer.
I'm just curious, are you doing any other renovations or buildings or expansions at UMAC?
Yes, sir. Mr. Chairman, we just recently completed a renovation of our mother-baby unit, which had been in the 1988 building, so it was in significant need of repair. And we did also improve our air handling unit to create isolation rooms for the mother-baby unit. And we are preparing to move forward with increasing a remodel improvement of our intensive care unit, even right now that we're working on. And again, with increased air handling capacity because of the COVID-19 pandemic.
Yeah, Mr. Chairman, follow up. Have you done other HVAC and increases through your whole hospital or have you yet to do that as far as upgrading that?
We have done some upgrades with that, particularly in our ICU. We're upgrading our ORs currently, and which is another remodel piece. And then we've also upgraded the air handling units for OB. And then in 2018, prior to the pandemic, we had updated the HVAC for our East Campus, which is where our behavioral health unit resides.
Thank you, Mr. Chairman.
Thank you. Further question, Mr. Secretary.
Thanks. I see this renovation. This is going in on the first floor. What's currently there? Where is that going? I mean, if that's already rooms, I mean, it's just a huge cost per bed. I'm looking at the increase on the beds, and where are you moving? What's currently in that location?
So, Mr. Chair, thank you. What's currently in that location now on the first floor are conference room areas. So we have repurposed other areas and other locations to hold conference type, education type settings. So specifically, we have a lot of orientation for new employees that go on in those rooms. And so we have moved those folks into another location.
Mr. Treasurer.
I'm just curious as whether Yeah, I know we're way oversubscribed on these funds. I just didn't know whether or not there's any place that else that from the federal government or someplace else that some funds, if we could increase your match or not, or whether that's available to you, or whether you've already dried up those wells.
Thank you, Mr. Chair. We have sought some additional funding from FEMA, and at present, that's not currently available.
Uh-huh.
No.
Yeah.
And if I may, Mr. Chair, the cost per bed is expensive, but this is a renovation, which is typically a little bit higher cost in some ways. And then in addition, it's a behavioral health unit. So we have to be really mindful of, there are specific furnishings that are only available for an inpatient unit that we have to be utilizing.
Thank you, Ms. Rowling. And further questions? Further questions? Hearing none, I don't see anyone online. I'm just going to ask if there's anyone online. Hearing none, pleasure of the board.
Mr. Chairman.
Madam Auditor.
I'm tempted to move to table this, but I think it is a highly solid project. Cheyenne pulls from a lot of surrounding communities, and this need has just exploded here. And I know it's the big city. Can they figure something else out? But the population, the population here is just a scale that our other communities who deal with different problems, but they just don't have to deal with the same level of volume that we do, coming from all angles. So I intend to support this project, either now or later, but I'm going to go ahead and move funding on it now, 7402-325.
Thank you, Madam Auditor. Is there support for the auditor's motion? Mr. Treasurer.
I'll support it, but I'll ask you guys that if you can get any match that would kind of help us out with funding some of these other projects between now and when the funding streams run out. I guess if you can help us out, that because any money that we save that you can find from another funding source that isn't really going to set you back, that it'll help everybody else. So just if it falls from heaven, and lands on your plate, send some over here. Okay. Thank you.
Yes, sir.
Okay, thank you. Now, that's been moved and seconded. Is there any further discussion? Any further discussion? Hearing none, all in favor signify by saying aye.
Aye.
Is there a nay? Nay. That motion carries. I have Mr. Secretary as the nay.
Thank you.
Thank you very much, Ms. Rowling. It brings us now to item 1243, St. Joseph's Children's Home HVAC upgrade is Chairman St. Clair, thank you very much for being here. If you're leaving or okay, all right, thank you. Please.
Good afternoon.
Yes.
Mr. Chairman, members of the board, my name is Rhonda Meyer. I'm the Executive Director for St. Joseph Children's Home in Torrington, Wyoming. Thank you for the opportunity. Sorry, did I not?
Thank you.
Yeah, there we are.
Thank you.
Thanks, Ms. Meyer.
Thank you for the opportunity to speak with you today and for consideration of our funding proposal. Real quickly, St. Joseph Children's Home is a 62-bed licensed psychiatric residential treatment facility housed in Torrington, Wyoming. We provide 24-hour supervised psychiatric residential care to children and adolescents ages 6 to 17 who have long-term mental health and psychiatric illnesses and serious emotional disturbances. And they have not responded well to interventions or have failed interventions that their local communities can provide. St. Joseph's is one of 2 licensed PRTFs in the state of Wyoming. The other licensed PRTF is Wyoming Behavioral Institute in Casper. St. Joseph's serves
all Wyoming youth. Currently, we have 40 youth and residents, all from all over the state of Wyoming. 77% of our population are children who are Wyoming Medicaid eligible. Our proposal today is to upgrade our existing HVAC systems on our existing residential buildings. We have 5 residential units that house youth based on age and gender in 3 buildings. These buildings, as we discovered throughout the pandemic, are not adequately ventilated. As you can imagine, these buildings were built to be secure. And obviously because of the population that we serve. So we can't open the windows. We cannot plug in fans and have fans available because of the population we serve. Our systems our HVAC systems do not provide the ventilation that's appropriate and necessary to keep our population safe as well as our staff safe. And so our proposal today is to upgrade our existing HVAC systems to better protect the youth in our care and our staff. And I'll stand for any questions if you have any.
Thank you very much for being here, and what a remarkable institution you have there. St. Joseph's is just an incredible place. So,
Thank you.
Any questions from the board? Any comments from the board? I don't see any.
Just
Mr.
echo
Treasurer.
yours, Mr. Chairman, it does a very good job at what it does.
Absolutely. Well, Mr. Treasurer, I'd give you the honor if you want to.
Mr. Chairman, I would move for approval of the St. Joseph's Children's Home HVAC upgrade in the amount of $1,422,761.
Thank you. Is there support?
Second.
It's been seconded by the Secretary of State. Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Thank you.
Thank you.
Congratulations.
Thank you.
That brings us to the last of the items on the list I have of applications ready for board consideration. This is item 1246, University of Wyoming, implementing community-based telehealth infrastructure to expand healthcare. Is there any? Thank you.
Hello, Chairman, members of the board. My name is Ty Baker. I am a program manager at the Wyoming Institute for Disabilities. We're an academic unit under the College of Health Science, and we're the home to the Wyoming Telehealth Network. I also have with me my colleague, Andrea Shipley. She works for the Wyoming Telehealth Network as well. And then a collaborator and colleague, Dr. Amanda DiDiego. She's with the College of Education, the Counseling Ed program. We just wanted to thank you for your time and consideration in this project, as well as your support and your continued support for telehealth. We joke that it took a pandemic for providers and healthcare organizations to fully support telehealth. And so we're seeing that as a silver lining of the pandemic, but there's still barriers and work that needs to be done, and that's what we're here to accomplish in one of those areas. So this project, the goal is to improve healthcare access, specifically through telehealth community access sites. And we're partnering with 3 public libraries, 1 detention center, and the UW extension offices to offer community access sites for patients to go and have a safe, secure, and connected to broadband and other equipment to connect with their provider. So this is essentially a pilot project with these entities where we're partnering with organizations throughout the state to be able to offer this service to their patients. Throughout the COVID-19 pandemic, there were many barriers that were exaggerated by COVID-19, the existing mental health disparities that we saw in the rural and low-income communities and areas, as well as statewide growing mental health crisis, physical and economic impacts of the COVID pandemic, and then barriers that still today exist with internet access, specifically for internet access, stigma, technology, and safety that patients are experiencing and prevent them from accessing care beyond provider offices. And so I'd welcome any questions that you may have. One other important thing to note is that a lot of our in-kind match and even cash match is put up by the communities that we are partnering with. So from the public libraries themselves or the UW Extension offices and detention center, as well as some of their foundations. And then in addition to the Wyoming Institute for Disabilities.
Thank you, Ms. Baker. Any questions? Yes, Mr. Secretary.
Thank you, Mr. Chairman. You mentioned that some of your match is coming from these community, such as the libraries. And I see most of our libraries in this state have extreme funding problems. In fact, some of them talked about closing libraries because of their funding problems. So it concerns me that they're spending money on something like this. And along the same lines, you say there's a detention center, which the detention centers were statutorily required to provide health care to those prisoners. So there is somebody there on staff. So I'm kind of wondering why.
Sure. Yeah, great questions, Mr. Chair. So I'll address the questions of the libraries first. The 3 communities that we are partnering with this particular grant had interest, and most of it's in kind. So not only is the, well, first let me back up. One of the things that we're hearing and where this really stemmed from was the Casper-Natrona County Library attended a presentation where they actually were the ones that were first heard of this and contacted Dr. Diego in regards to this idea, and it's really expanded from there with support from the state libraries as well. So the match oftentimes is put up by their foundation, and then the in-kind match for the space that the booth, because there'll be a physical space. If you think of a booth that will be in existence that individuals can go in. It's secure, it's confidential, and that's where they can access their telehealth visit. And so it's not in addition to any of the money except for what they're putting in for the time and the space for the booth in the area holding it. The other in kind is the scheduling system that they're offering up that we could tap into. They're utilizing this scheduling system already for the community rooms that they house within their facilities. So they're going to be adding on to that to schedule the telehealth booth sites. So that's in addition to the in kind as well. But I absolutely get your concern. The very first thing that we do before we're starting to partner with them is see if there's even an interest. And that's why there's only 3 sites listed on this, because this is something that we're continuously determining if there's feasibility in that local community, in that library, as well as interest, and something that they see as a need for the patrons that are already visiting their libraries. As for the detention center, it's specifically Sweetwater County Juvenile Detention Center. And one of the biggest issues that they've seen is with lack of staff being able to continue continuity of care to mental health for the juveniles that they serve. Some of their juveniles are accessing mental health providers outside of the community, and that's not something that they're able to continue. The portion of the grant that we're asking for is truly just equipment and not necessarily a physical space, so that they can utilize telehealth in the pod so that they don't necessarily need to lose the transport of a juvenile to provide that. It's truly to help them figure out how to provide telehealth to the juveniles within their facility.
Thank you. Follow up? Okay, thank you. Any further questions? Further questions? Okay, thank you. What's the pleasure of the board?
Mr. Chairman, I would move approval of the University of Wyoming implementing their community-based telehealth and infrastructure to expand healthcare for the amount of $178,200.
Thank you, Mr. Treasurer. Is there support for the treasurer's motion?
I'll second.
It's been seconded by the auditor. Is there any discussion? Mr. Secretary.
Thank you, Mr. Chairman. You know, as I looked at this, and I understand, okay, so we got some of these narrow funding things, and this fits one of those buckets. But, you know, I've talked to just about every single insurance company that we have out here, whether it be Cigna, Aetna, Blue Cross Blue Shield. Every single one of those offers telehealth lines. And as I've spoke to them, they're widely underused. They they have those lines out there and they're not used very much. I do have also some concerns with, as they mentioned, it's a juvenile detention facility. With that, we come into an issue of if it's a juvenile, whether they have been placed under the, the care of the state and had parental rights removed from that. If not, the parents have rights to be involved with that. If it's under the state, then the state has a right. So juveniles are a very special area there, and for them to be talking to a health professional without oversight on that, that's a problem. Just because we have a narrow funding thing for this, I don't think there is really a use for this, a need for it. Sure, the libraries may have some interest in it just because, hey, it's something we can throw in there. I believe it will be widely underused. Like I said, as I spoke to the insurance companies, these are not programs that are begging for a solution. So I would definitely be a no vote on this one.
Thank you, Mr. Secretary.
Mr. Chairman.
Madam Auditor.
I think the secretary makes some solid points. I come to it with a slightly different understanding. I think with the addition of your testimony, I think my understanding is telehealth is available from all of these insurance companies, and it is underutilized. And a lot of that problem is because folks do not have access to the equipment at home, the Riverton people might tell on me about this. I think of my folks who have access to a computer, but it's pretty intimidating to all of a sudden. I mean, think back to March of 2020 when we were all trying to Zoom for the first time, and we were awful at it. And so I think I'm assuming that part of the program's thrust is to say, okay, not only can we provide you with this equipment for your telehealth appointment, but we're also going to have somebody there to say, okay, here's your camera's off. oh, Mr. Chairman, you're on mute. You know, that is here. Well, let me help you with that. And I'm trying to poke holes in it, just like we all should be on all of these. But I see public libraries, as far as I can tell, are all on public bus routes. So we're maybe talking about a population that doesn't either have access to the devices or a vehicle. And so this is I'm not sure there's an existing place for somebody maybe without transportation or without the technology to go and utilize some of the telehealth that ultimately does save money. So I was certainly on the fence, but I think I'm going to be a yes vote on this. I think the dollar, and I think it may not work out. It may be difficult for libraries to manage. Maybe library staff don't want to be sort of helping, someone with their medical appointment. And so that would be a concern, but I think it's maybe worth a try.
Thank you, Madam Auditor. The other piece to me that I think about, and maybe you can sort of help me, Ms. Baker, is we have a tremendous number of veterans here, and they obviously have access to the VA and TRICARE and other opportunities and so on that I would hope that they could avail themselves of. But it's still a challenging time for veterans and somewhat private. And I don't know if you can give me any sort of confidence that veterans would feel that this would be a great service for them.
Mr. Chairman, I don't have any specifics, but I will say, one of the benefits of working one of the benefits of this project is all of the partnerships that we have. And so one of the things that we do is facilitate the Wyoming Telehealth Consortium and have a number of statewide partners, one being the VA, where we get to brainstorm and partner with them to think about what types of patients, what providers are going to be utilizing this. The cool thing about this project is that we are not the first in the nation to be implementing something like this specifically through libraries. This is a model that has been implemented through states in our region. Idaho specifically, we've learned a lot from, and we've asked very specific questions about what has worked for them, what hasn't worked, and how we can learn from that. Additionally, like Ms. Auditor said, we really see libraries being a hub for the vulnerable, low-income, uninsured population that may not have access to those already existing telehealth programs through Blue Cross Blue Shield or through Cigna or other healthcare agencies. This is really, and if they don't have, if patients don't have access to health insurance, they may not have access to broadband, the equipment, they may not have minutes on their phone to connect, or even transportation. Although, the library could potentially be a hub for them to be able to access that.
Okay, thank you.
Yeah, Mr. Chairman.
Mr. Secretary, let me recognize the treasurer and then you, Mr. Treasurer.
I guess I support it because I think it's a more efficient way of time management for myself personally to do telehealth, because it saves me, a half hour to an hour a day between driving and sitting in a waiting room.
You can't read the retirement magazines, though.
But I got everything right there in my computer until it pops up.
Yep.
So, I think you get the same efficiencies, especially in a situation that was an institution that could direct people to doing that. So I think it's going to be cheaper for the state to implement healthcare through telehealth rather than getting people in a transport vehicle and taking them someplace. So I think there's going to be some economies that we should see if they do occur during this pilot project, and see whether or not we can actually save the state some money in the provision of healthcare in all institutions.
Thank you, Mr. Treasurer. Mr. Secretary.
Thank you, Mr. Chairman. With a lot of these comments and stuff, and as you mentioned, VA and things, a very quick search on the computer, there's over 50 free telehealth apps, including from the VA. Libraries already, a lot of these you can do on the telephone, you can do on your computer home. If you want to do it at the library, every library in the state has free computers already. They have privacy on those computers if you want to do that in a private room. They have help there on the computers with the people. I just don't see a place to expend this money when it's free. It's all over the place here. Like I said, if you don't like one, go to another one. And these are all a very quick search. They're there. So I don't see us spending money on something that is already there and it's already free.
Thank you, Mr. Secretary. Is there further discussion? Motion's before us. It's been seconded. Is there any further discussion? Hearing none, all in favor signify by saying aye.
Aye.
Nays?
Nay.
That motion carries.
Thank you.
Thank you. That brings us to the end of our applications ready for board consideration as of November 14th, 2022. Ms. Blackwell or Ms. Sewell, you usually are very good at keeping track of where we have left off and what the balance is. I want to, if there's a way to give us some idea that we still have some firing capacity, I really would like to be able to make sure we know that.
As a whole, the board approved $33,631,256 in grants today.
Can you repeat that?
$33,631,256
$256.
Thank you.
That leaves us a remainder of $51,368,744 going forward. So based on our simple calculations, 35.5 million of that came out of the general pot. Oh, sorry, we have 27.5 came out of the general pot, leaving 35.5 to be spent. $4.7 million came out of the 7 million for behavioral. That leaves about $2.3 million available for that pot. The rural health we spent just under $1.3 million, and that allotment's $13 million. So we have $11.8 million left to spend there. And for telehealth, we spent $178,200 out of the $2 million, leaving $1,821,800 remaining.
Thank you. Any questions? Any questions?
So just want to make sure of this process. How long do we have for that money to be spent? Is that till 24, 26? I'm trying to remember.
Mr. Chairman,
Ms.
Mr.
Blackwell.
Treasurer, the funds have to be encumbered by the end of 2024, and they must be spent by the end of 2026.
Okay, all right.
Thank you. Further questions? Hearing none. Madam Director, is there anything you'd like to?
Mr. Chairman, thank you. No, I think we will be looking at trying to put together another meeting in mid-December. So just ask people to keep an eye out for that. And we will continue working the process and hopefully can bring as many applications that are ready for board consideration in front of the board at mid-December meeting as we can. So.
Thank you for that, Madam Director. If there's nothing to come before us anymore, I would entertain a motion to adjourn.
So moved.
It's been moved by the secretary. It's been seconded by the auditor. All in favor signify by saying aye.